and spinal adjustments. So what we want to do today is kind of give you guys some information. Hold on 1 second. There we go. On basically what you guys can do for scoliosis, like what options are out there, and decide what's best for you. That's all today is. And I noticed that as most people are, it's usually an adolescent female that has scoliosis. That's why I have this up here: as a twig bends, so grows the tree. So it's really good at this point to get them at a nice foundation, spinal structural wise, so that it doesn't get worse. And as you get older, you're more likely with scoliosis to get disc degeneration, arthritis, lung function issues, heart issues even, and actually lifespan reduction. So we definitely want to none of those things to happen today. So we're going to go over who's at risk most, signs and symptoms, long-term risks, treatment options, and just want to make an informed decision today of what's best for everyone in this room. What is scoliosis? That's kind of the question right now. According to the Scoliosis Research Society, it's a lateral deviation of the spine from the frontal plane that is more than 10 degrees. And how they measure it is, so it would be something like this. Actually, it would be more like this. They take the top vertebrae with the most bend and draw a line through it, and the bottom vertebrae with the most bend and draw a line through it, and they measure it that way. And that's how they get their angle. Usually there's also called pseudoscoliosis, which is very, very easy to treat. Basically, pseudoscoliosis is when there's just a bend but no rotation. I don't know if I know you've seen other healthcare professionals, and they talked about that rotation of the vertebrae. I don't know if they mentioned that. That's when it's really scoliosis, when it has that rotation of the vertebrae.
Actually, I've read that.
Yeah, Nash-Moe line sometimes it's called. These little processes should be up and down, straight up and down, right in the center. When it has that rotation like that and it bends, that's when it causes the issues. That's when it's full-on scoliosis. These are some quick facts. Scoliosis affects about 2 to 3% of the population. It doesn't sound like a lot, but when you think about it, in America, that would be about between 6 and 9 million people a year have scoliosis. Females are 8 times more likely of being diagnosed with scoliosis than males. There's a lot of theories behind that. One of them, the one I buy into, is that usually females have their growth spurt earlier than boys, and during that time they also have menarche, or their first period. And a lot of times when you have those hormones coming in and that growth spurt, a lot of researchers think that it can mess with the growth and also cause scoliosis because so much is going on in that body. 90% is what is called idiopathic. Idiopathic means we don't know. We don't know what the cause is, and we spent billions and billions of dollars in research, and we still don't know what the cause is in 90% of the time. So those are some of the quick facts. So again, cause and effect. I'm big into research, so I'm trying to figure out why, the cause and effect of scoliosis. So one study I did find in Spine Journal was a lot of times it could be due to breech births. Actually, believe it or not, they did a study out of 6,000 cases of breech babies, and found out that 42% developed postural scoliosis, 20-25% torticollis, which is twisting of the neck, wiry neck, jaw asymmetry, and 50% had hip dislocation. Another cause is what is called the brainstem anatomy. I don't know if they ever learned this in science class, ladies, but the brainstem controls balance and posture. Back in this area right there. What they're finding out in a lot of scoliosis cases is that this area right here, the upper neck and the skull, is kind of jammed together. So that can interfere with your balance and posture, and that can also cause scoliosis. So that's one area we always check in our clinic right away. It's called the occipital lano area, where we check it to make sure it's not locked up. And then we go from there. Most patients are locked up in that area, and it messes with their posture and their balance. There's 4 types. One is infantile, that's 0 to 4. Juvenile, 5 to 11. Adolescent is the most common diagnosis. This is the onset of puberty, full grown. And then there's adult, which is either undiagnosed or due to degenerative changes in the spine. Adolescent is what we mostly see in our clinic. again, that's the most common, and unfortunately that's also very progressive also. Scoliosis effects. This is from the National Scoliosis Foundation, the Scoliosis Research Society. These are all been tested and found out, again, clinically, in our clinic too. This sounds about accurate. About 100% of all scoliosis cases, 100% have balance or coordination dysfunction. Again, because when the spine's bent, it's hard to have coordination if you don't have that perfect symmetry. 80% have developed chronic menstrual irregular problems. Reason being is that when your spine is bent right here, these nerves go to different organs in the body, and that can mess with that area if it's not in the right position. 50% digestive problems, same thing here. If there's a problem, if it's bent, it could be pinching on the nerve, causing some digestive issues. 100% develop if it's not treated chronic back and neck pain. And they actually did a study and they found out what the normal life expectancy is of a normal person, asymptomatic, and then what they did with scoliosis patients and found out on average there's actually a 14-year life year reduction. So it can affect so many things. Lung function, what happens is a lot of times when there's a bend up top in the thoracic area, that's going to compress one side of the lungs. It's hard to take a deep breath in. It's hard to get that oxygen. We see this in a lot of athletes. One thing they always complain about, they have scoliosis, is when they're playing sports, their lung function's compromised. Cardiovascular, heart dysfunction, higher rates of depression. They did a lot of studies and found out that psychologically it's a big issue, especially with adolescent females, because at that time it's hard. You want to fit in. Then a lot of times they don't want to wear certain clothes because it shows on the back, like it could show one side higher than the other. It's a very delicate age for everybody. So it shows psychological impairment and lower quality of life. So that's my big beef. Is a lot of people just say it's just cosmetic. But it's a lot more than cosmetic. As you can see, it's a lot of physical ailments that can cause it, a lot of emotional problems it can cause also. And this is how the vicious cycle usually starts. What happens is there's a triggering event. Again, 90% of the time, we don't know what the triggering event is. And it causes a spinal curvature. Then what happens is, unfortunately, we have this thing called gravity pushing down on us the whole time. And what's going to do, the spine's going to do anything to stay stable. It's going to do anything in its power to stay stable. So what's going to do is going to rotate. It's going to cause some rotation in the spine. And again, gravity's still pushing down. This can cause spinal deformity. It's going to keep on progressing as long as that gravity is pushing down. And a lot of times it's going to cause torso, like trunk issues. The trunk gets locked. You can't breathe. And it just keeps on going in this horrible, vicious cycle because of gravity and because nothing's fixed. It's going to cause one side of the disc to wear out faster than the other. Muscles are going to be uneven. One side's going to be more contracted. This side's going to be stretched. The muscles are. And it's going to cause a whole lot of issues down later on in life, unfortunately. Again, torso mobility. This is reduced lung function. Reduced lung function, you can't reduce work. Shallow breathing. Shallow breathing causes cardiopulmonary distress. And this causes pain and psychological distress. So it's just a bad, vicious cycle. Signs and symptoms. You guys probably already checked already. Clothes fit unevenly. High shoulder, high hip. It's usually on the left side or right side. It's usually the same side. Most people, they have a high right shoulder and a high left hip. With scoliosis patients, usually it's the same side. Rib humping, which is what they probably check the Adams bending test where you put your hands together and you bend down. One side will be higher than the other. Decreased lung function, like I said, you can't breathe, you can't get that oxygen. And back pain. Back pain's more seen in adults. We don't see it as much in the adolescent age, but more in adults because they've had it for a while. And this is the medical community approach, which is how they are dealing with it right now. Most of the time, between 10 to 20 degrees, they usually do the wait and see approach. We're going to wait to see what happens, which is my personal opinion. I think it's a little flawed. I think you should be proactive while you can, and that way you can just get rid of it and not worry about it. This is usually, they do 1 to 2 x-rays per year to see if there's any progression. They do NSAIDs for pain or chiropractic manipulation for pain relief. So nothing's really correcting it. They're just kind of waiting, the wait and see approach. Then from 21 to 40 degrees is usually the bracing approach. There's all types of bracing. Right here is what is called the good old-fashioned Boston brace. Right there. There's also the Milwaukee brace, which is before the Boston brace. There's also the Charleston brace, which is a sleeping brace, and the Rigo-Shano brace. The problem is that, you've heard with the braces, you got to wear them for about 23 hours a day, 2 to 3 years to be effective, and obviously there's going to be big time compliance issues. In fact, they did a study and found out that there's a 15% compliance rate, which, again, like I said earlier, when you're an adolescent, the last thing you want to do is wear a big bulky brace to school and wear it out with your friends. It's a problem. It's a social issue. Because when they made these braces, again, the doctors had the really good intentions. They really did, but they didn't take the child's psychology in effect, their emotional status in effect. Again, no one wants to wear a big, bulky brace. In fact, in Dublin, Ireland, the Children's Research Center says 91 bracing has not been recommended for AIS, which is adolescent idiopathic scoliosis. It hasn't been recommended. You'll see, again, when I went to the scoliosis conference in Chicago that you and I were talking about earlier, and they have a lot of European doctors there, a lot of European specialists, and bracing is just not as big as it is in the States. That's the big thing they notice, is that bracing is just not as huge as it is here. And surgery, this is what we don't want. Sometimes it's recommended 40 to 50 degrees or after, depends if it's progressing. It's something you don't want to do. You want to avoid it if you can, okay? What they say is that it usually reduces that Cobb angle, that angle in your spine, by 15%. But the caveat is that the frequency of pain is not reduced, your pulmonary function did not change. This is from the Journal of Bone and Joint Surgery. The initial loss of spinal correction is 3.2 degrees the first year, 6.5 the second year, then a degree every year. What this means is, for example, say it was 60 degrees was the curve, and they reduced it to 30. That's 50%. What they're saying is that after the first year, it's going to go to 33% because of 3.2 degrees. Then it's going to go to 36 degrees. Then you're just going to keep on gaining a degree a year the rest of the way. So long-term correction is very, it's not, the prognosis is not good. So it's a big, big issue. 40% of operated scoliosis treated patients with IS were legally defined as handicapped people 17 years after the surgery. This is from the Journal of American Medical Association. They mention things such as heart failure, wound infection, reduced physical activity, complications. Like I said, the hardware will break sometimes actually in it. So it can be a big problem. Now there are cases where people absolutely need it, absolutely, but not in a lot of the cases. Even with me being a chiropractor, you think I'd be very partial toward the just the chiropractic adjustments, but the research out there from the Journal of Manipulative and Physiotherapy states in 2001 that full spine chiropractic adjustments with heel lifts and lifestyle counseling are not effective in reducing the curve. So you need more than adjustments to reduce the curve. So we're telling you a lot of things that are not working to their full ability right now. But a new method was introduced from the Biomed Central Musculoskeletal Disorder Journal. They published an article in 2004 that combined manipulative therapy, spinal manipulation, with postural, neurological, and balance therapy. And we'll go over these pictures later. Hopefully I can turn off the lights so you can see that. Basically, it was a small study. It was a small cohort of 22 scoliosis cases with a Cobb angle ranging from 15 to 52 degrees. After 6 to 8 weeks of treatment, the average reduction was by 62%. None of the angles increased. There's been 6 other peer-reviewed articles on the spinal system and method with scoliosis, and all produced favorable results. So this got me interested. This is when I was in school when this article came out. It got me really interested in this method. I'll say, man, I don't know if this will, so you can see this or not. Oh, it'll come out later. Basically, these are, if you want to see the computer afterwards, that's fine. There's before and after pics of the Cobb angle being reduced greatly. Basically, this method is called the Pettibon system. The Pettibon system says that there's what the principle is, and this is true with scoliosis, that there's a normal side alignment. I don't know if the specialist or you guys read this, the concerned moms read this, but basically there's a normal side alignment. This, again, frontal-wise, the spine should be straight up and down. From the side, there should be a curve in the neck, a backwards curve in the mid-back, and a forward curve in the lower back. When we have this, we should have good balance. There should be no rotation. The spine should be up and down. But what happens is when your body loses these curves for some reason or the other, what's going to happen is the neck curve goes out. The body's going to do anything to put itself a curve. The reason your body wants a curve is because you have what is called a spinal cord in here, and when it gets stretched out, it messes with neurological issues. So it's going to do anything that's possible to put that curve in the right place. So when we lose this curve, what happens is when we lose the curves, it causes a lot of issues in the back. With all my scoliosis patients, all of them, 100% of them, they have a straight neck, or it's worse. It's never perfect. It's never like this. So again, research shows that scoliosis patients do not have a normal side alignment, or you'll hear me say sagittal, side alignment. So again, like we talked about earlier, if this is the wrong place, we talked about the atlanto-occipital area. This is the brainstem right here. If this is in the wrong place, that's going to mess with the brainstem area, and this is going to cause a lot of balance issues and postural issues with the rest of the body. Like I said, sagittal misalignment may play a role in the disease of scoliosis. So the first thing we always do is address the neck, skull and neck in our clinic. If this side view, especially the neck and the skull, cannot be fixed, we do not accept you as a patient, because it's telling us that long-term wise it's not going to work, because this needs to be fixed before this can be fixed. So we have to fix the side alignment first. Again, they always have a loss of side curve. So what we check on the first visit is lung capacity. How are you breathing? Again, most times we see their oxygen levels are not where they should be. Scoliometer, which measures the scoliosis as an orthopedic exam. Postural analysis, we take a couple pictures, we see if there's a high shoulder. We measure the leg length actually also to see if the legs are even. X-rays, again, side views are always included. So this is something we always include in our visit. What is done on every visit? Our average visit will take about an hour with each person, because what happens is what we want to do is it's a very active rehabilitation process. Patient has to be compliant, but it's a very active rehabilitation. We warm up the soft tissue around the spine. We do the adjustment. We do stuff that stretches out the ligaments and tendons. We do the weighting system, which I'll show you a picture of later. Certain traction movements to reduce that scoliosis. Balance retraining, strengthen postural muscles. We do this all in the therapy. We'll start with this picture right here. You can see this person has funny weights on. I don't know if you can see that or not. They have something on their head, their shoulder, their hips. There's certain weights in the body. What that's supposed to do is strengthen the weakened postural muscles. Most scoliosis patients, their shoulders like this, their head is like this. What this does is brings the shoulders back and strengthens the neck muscles. We do vibration therapy, which actually strengthens the postural muscles. Something called the Schroth method, which is based in Germany. It's been around for about 100 years. There's certain exercises you do to, again, reduce the scoliosis and strengthen the spine. And also what is called the tornado suit, that picture right there, which is used to reduce the curve. It's actually called an activity suit. It's not really a brace. It's an activity suit that patients wear if they're a candidate. Then the whole suit itself weighs less than a pound, and it's made of like lycra material. It's kind of like Velcro and lycra material. Lycra is kind of the Under Armour type of material. So it helps pull the spine in certain areas. So it's an interesting thing. So we combine this with the tornado suit, because again, what we want to find is the best way, least invasive, most cost-effective way for you guys to get the benefits. So we combine this with the tornado suit. Again, I was never big in hard bracing just for the simple fact that no one likes doing it, and the compliance rate is super low, and the results have always been sketchy. Been good and bad. So it's the first activity suit for scoliosis rehabilitation. It can be easily worn under her clothes. In fact, we have a patient, she plays sports for Armada High School, and she wears it underneath her clothes. I mean, you can't see it.
It's almost like a sports Under Armour.
Yeah, exactly. That's what it is. And yeah, you can wear it underneath. You can't tell if someone's wearing it. It's very. I mean, after we show you how to put it on, it's pretty easy. But we'll probably take about 10-15 minutes to learn. But after that, it's very easy. And you wear. You know, we start out having the patient wear 45 minutes a day for the first week. You eventually build up to 8 hours a day, but that's as far as it goes. So 1 to 8 hours a day, but always start off by, we tried starting out from 5 to 6 hours, and the compliance rate just went down the tubes because they were extremely sore. So we kind of got to meet the patient where they're at. And the suit can, it definitely puts the body in a better position. Unlike, like I said, unlike conventional rigid bracing, these actually, which weaken the core muscles. The problem with, the hard brace is that, you're in that brace, but as soon as you take it off, hasn't been activated. Your muscles haven't been activated at all for the whole. How many long do they want her in there? Did you say? Oh, I thought you said she had a hard brace.
No, she would never wear the one out in public.
Oh, God, I thought she had one. Okay. Yeah, with a hard brace, a lot of times they wear it, and you're kind of in there, but it's nothing strengthening the muscles. It's just holding your spine in place. And as soon as you take it off and gravity comes into play, the muscles are weakened. That's what I believe what happens. This actually increases your postural muscles while in the suit. We're one of 5 clinics in the world certified in the tornado suit protocol. This is what the suit looks like. I'm actually going to see if we can turn off this light really quick because I want to get a better view.
It's getting dark.
Okay. She has, it looks like she has a left curve, a lumbar curve in the back going to the left, and a thoracic curve going to the right, which is the most common double curve we have. What it does is it's all strong Velcro material. We use the thighs and anchor. The reason we use the thighs and anchor is because most braces have the pelvis as an anchor. The problem is most of the time the pelvis is off because of the scoliosis. Usually there's a high hip. So we use the thighs and anchor, and what we do is we have what is called the lumbar piece, which is, again, you can stretch it out, which you pull around the waist, and you pull this part of the curve, again, the scoliosis to the left, you pull it more to the middle. And we show everyone how to do this at home. And we take an x-ray to make sure it works. And so that'll help this piece right here. Then there's a top piece called the half vest, which, again, the curve is over here, and it opens this way. And you actually pull it. So they have the vest on. I should have brought the tornado suit. You pull it towards you, so that if I stand here and pull it, it's going to pull the spine toward the middle also. And there's what is called long tension straps, which actually, it depends if you need it, actually provide more tension on certain curves and angles. Again, and usually it reduces the curve between 15 and 40%. Usually we see about the lower rates, like the 15-20%, is in adult scoliosis patients, and the higher rates usually in adolescents because their spine's more flexible. Again, the first time you put it on, it may take a while, not a while, like 5-10 minutes, but we'll be there to help you out. And then it should take less than a minute after that. So very easy to put on after a while. Again, you can see how she's standing on the left to the right, how she's more upright. This is Mary Ann, she's in white, that I use her name. This shows that, again, this lady right here was really close to having spinal scoliosis surgery. Then her sister-in-law, who's a cardiologist, told her, don't do it. So she actually came to our clinic. You know, we helped her out. Then she wanted to learn about the tornado suit, and we definitely helped her with that. We don't see her that much anymore because she's pretty much pain-free. So, and her scoliosis reduces as much as it can right now. So, but she's doing really well. Basically, within the TSP, we use all the non-invasive therapy that all over the world that we have at our disposal. We use things for scoliosis reduction, the Pedibond weighting system with the funny weights, the Schroth method, which is another the Germany-based physical therapy, the tornado suit, and torso exercises to get rid of the rotation. So we use all these things at our disposal at our clinic. But again, like, I know this sounds great and fantastic. I always tell patients that you have to be compliant. This is the number one thing. You have to be compliant. There's no use in starting if you're not going to go full out on it. That's the first thing I always tell patients when they come in is, you know, you really got to be committed. If not, this is not the right place for you at this moment. So you have to be committed. It's going to take a minimum of 30 minutes a day starting out. And for it to be effective, you have to do your home therapy. I always tell the patients also that it's really 25% of what happens in the office, 75% of what happens outside the office. So, you know, before you think about coming, just make sure the person's really committed to doing it. Nothing's going to hurt, nothing's going to be painful, but it's just like working out or exercising. You just got to get in that routine. Once you're in the routine, you're fine. But it takes a minimum of 30 minutes a day. And it's just really wearing the suit and wearing the certain weights that will really help the correction. Some of the results we've gotten is a 12-year-old was progressing pretty good. She went from 16 to 7 degrees in 3 months. 45-year-old adult scoliosis, 40 degrees to 26 degrees in 7 months. The female from Armada, 15-year-old, went from 25 degrees to 8 degrees in 9 months. And during this time, I want to make sure that during the 3 months, like the 9 months, the 1 year, the 2 years, it says that I'm not seeing you the whole time. I'm not seeing you every day during this time. But what we expect you to do the home therapy though, almost every day. So at least for the first 3 to 6 months. So I'm not going to see you every day. Like I said, but I want you to do the therapy. The 54-year-old that we showed, she had 64 degrees actually, and she went to 46. And we have a 14-year-old who was at 58 degrees, progressing rapidly, is down to 40, and luckily she avoided surgery. So again, but these people are committed. They do the things. They're there and committed to do the therapy. So again, big thing is we want to know. You're more than a spine. The patients are more than a spine. We want to know. We want to affect your overall quality of health, your life, your emotional status. Perform better in sports, have better self-esteem. So that's really what it is more than a spine, and we want to go from there. Breathe better and so forth. So, is there any questions at all? Because it was a lot of information, I know.
Yeah. Does it matter what time of day you do this?
That's a good question. No, actually, it doesn't. Really, it doesn't matter. For the weights, like that, for that really funny head weight, I like first thing in the morning. Reason being is that really, when if you ever get up from bed, you're kind of getting your kind of scruples together. Yeah, I couldn't come up with the right word. And so I think that's the best time to do it, is because like your postural reflexes are very impressionable at that time. So I like to just put it on
So
there.
do you put it on and you do certain moves, or do you put it on and walk around?
You just walk around. You walk around. Well, it depends. Most people walk around. 99% of people walk around or stand. Some people have to stand because we talked about that side alignment. Sometimes they have to stand against the wall because we put a block there to put more of that curve in. But yeah, you can stand, walk, watch TV. I mean, just that's yeah. I mean, it's pretty easy things to do. And you're also let's see if you can see it because we turned off the light. Something called blocking, which is for the tendon and ligaments I mentioned earlier. Yeah, that's not a good picture. Well, actually, this is kind of what it is here. She's laying on her side. I don't know if you could This is her right here. She's laying on her side.
Yeah, and there's something underneath.
Yeah, and that's for the curve. Like the patient will do something like that. This is part of the Schroth method. The patient will do something like that at home. We actually give her the blocks to take at home. So I mean, it's not really going to cut anything as long as if you watch, for 10 minutes she'll do this.
Right.
As long as if you watch TV or read text or on the phone,
Right.
it's really not going to cut out anything in your day.
What about an inversion table?
Inversion table can help. Yeah, it can help stretch out. It's not going to correct anything, but
Right.
but it can help loosen up the
My
spine.
husband's like adamant about getting one.
Yeah, it can. What it can do is help. Because we talked about the traction. That's one thing we always mentioned is that it can actually help. Yeah, because what it does will take pressure off the discs, and you could. I would definitely do it if she's going to do it. Do it before you do the therapy because your spine's more flexible
Right.
after.
And it gets fluids in.
Exactly, in the discs, and it takes the gravity out of the discs too. Yeah, because what happens is when you get rid of that gravity, the scoliosis just automatically reduces because you're eliminating gravity. So, yeah, I think that's perfectly fine. It makes a lot of sense. So yes, that's something she wants to do. That's fine. Yeah. Any other questions?
We're going to do everything that
Okay.
we can.
Is there any? You guys good? Okay. Okay. If you're interested, again, the decision's always up to you. Is that Sandy's here, and if you want to schedule a complimentary consultation to learn more and a complimentary exam to learn more and see if we can help, we can do that. The first appointment is probably going to be about 45 minutes, just because with scoliosis exam we do a lot more than a traditional patient because we do have to do more tests. So it'll be about 45 minutes. Then what's going to happen is usually if you decide to go on to the second visit is what is called the sample treatment. Second visit lets us know if we can help.
Okay.
So about 90% of the people we can help, 10% we can't for some reason, like their body just doesn't respond to the weights or the suit. Usually I can tell right away if we can help someone or not. Most people we can't help are usually older or they don't have a lot of muscle mass. Like they just can't. I'm not muscle. They're kind of overweight, but there's not a lot of muscle tone, I should say. So the body just doesn't respond to anything that we do. But that's usually the people that don't respond well. So that happens for the second visit. The second visit will probably be the longest visit you'll ever have. It'll be about an hour and a half. And then the third visit, we let you know how many visits, what's the out-of-pocket, and if we can help. So everything's laid out, so there's no surprise costs or surprise visits. Like we lay our cards on the table, then you decide what's best for you. So.
Now, what about, because you said that you do x-rays, if she just recently had 2 x-rays done, could I bring those?
Yeah, you can bring those. Was she standing?
Yes.
Okay, as long as you're standing, that's fine. Did she take any, and we may have to take a side view,
Okay.
because we talked about that,
No.
because we talked about that side alignment
Yeah.
we need.
Yeah.
So we won't have to take the lower back or probably the thoracic view, but we may have to take the side view and then with her the equipment to see if it works. So.
Okay.
But yeah, we can cut out those 2. Did they take just 2 of them?
Well,
lumbar
when we went to the doctor's office, they took one there. I brought the disc with me. It's a pediatric.
Okay.
And they took their own
Okay.
because they said they had something different than what the other place could do.
Okay.
So they took their own. I can get a copy of it.
Okay, yeah, that'll be be good if you can get a copy. If not, if you can get a copy, if you can. If not, we may have to take it. But I always tell people because X-rays are a big concern. I understand. Mayo study did a clinic and said to harm a fetus, to get overexposure for a fetus, it takes over 3,000 views. So I always tell parents, don't worry. But if we have the views, might as well use them.
Right,
So
right.
I completely understand with that. Yeah, and hopefully, and I always like to schedule the scoliosis patients around the other tornado suit patients, so you can kind of see what goes on and the therapy involved and everything else. So, so yeah, so yeah.
Okay.
That,
I have any other things that pop up, I'll sugar in.
Okay. Yeah. So so whatever you want to, if you want to schedule now or later, it's up to you, or
I
go from
will.
there. So yeah.
Write me down.